project is to hold a webinar on the theme of AIDS awareness and prevention. Next, I will briefly introduce to you a little knowledge about AIDS, and the reason why we held this webinar is to enrich the public's awareness of AIDS, improve understanding, and raise awareness of prevention. Hello everyone, this is the poster of our AIDS advocacy and prevention webinar. Next to the poster is a more detailed explanation of the elements in the poster, so let me summarize it for you. The poster's overall message is to raise awareness about World AIDS Day and to emphasize the importance of global solidarity in the fight against HIV or AIDS. It encourages people to support those affected by the disease, to educate themselves and others about HIV prevention, and to participate in efforts to reduce stigma and discrimination associated with HIV or AIDS. The combination of the red ribbon and the holy hands really communicates compassion, support, and unity, reinforcing the idea that by coming together, the global community can make a significant impact in combating the HIV or AIDS epidemic. To determine the purpose of the event. First, with awareness, educate participants about the spread of AIDS and ways to prevent it. For example, the main transmission routes of AIDS and effective measures to stop the spread of HIV. Second, share resources. Share resources of organizations or websites that prevent free HIV test strips. Third, community participation. Encourage participating community workers to cultivate a sense of community and actively organize community prevention work. On the first point, we will have a further explanation to the public at the webinar. The first step in raising awareness of HIV prevention is to understand its main transmission routes and protect yourself when in contact with people living with HIV. The first one is blood transmission, which includes blood transfusion and iatrogenic infection. The second one is mother-to-child transmission, which includes pregnancy, childbirth, and breastfeeding. The third one is sexual transmission. Sexual transmission is the case of the high incidence of HIV infection. Risk factors for sexual transmission include unprotected sex, multiple sexual partners, and sexually transmitted infections and unsafe sexual practices. The last is the other transmission routes. Examples include touches and improper handling of medical devices. Handling of or piercing with unsterilized tools can lead to HIV transmission. Use of unsafe syringes, needles, or needles in medical procedures. Other medical devices can transmit HIV. Here we need to know what are the non-transmission routes of HIV and prevention measures. By learning this knowledge, we can avoid unnecessary panic when contacting people with HIV. First, let's move on to non-transmission route, which includes daily contact such as shaking hands, hugging, and sharing utensils or toilets. The second one is air or water. HIV cannot be transmitted through air or water. The last one is mosquito bites. There is no evidence that mosquito bites can transmit HIV. Now, let's move to preventive measures. The first, but the most important one is safe sex. Use condoms and reduce the number of sexual partners. The second one is mother-to-child blocking. HIV-positive mothers should take mother-to-child blocking treatment under the guidance of a doctor and avoid breastfeeding. The third one is education for all. Raising public awareness of HIV transmission routes and prevention measures through education, which is why we are holding this webinar. The last one is safe blood transfusion, ensuring that blood transfusion and blood products used have undergone rigorous HIV screening. Let's move on to the second part of the webinar preparation, identifying the target audience. Our target population is mainly divided into the following four categories. The first, the general public, people who have a very one-sided understanding of AIDS and fear of those infected. Second, high-risk groups. Target groups at high risk of HIV infection, such as adolescents, LGBT groups. The third one is community hospital health workers. Educate doctors, nurses, and social security health workers on the latest prevention and treatment knowledge. Last, government and relevant authorities such as the health department inform local and policymakers of the importance of HIV prevention and control efforts. That's all there is to identify the webinar's goal and target audience. Now let's ask my teammate Li Yangdong to explain the third part of the preparation.
This part is set the agent. Firstly, I will introduce the objectives and importance of conducting this webinar. The objectives and importance of conducting this activity include the following points in addition to raise public awareness of AIDS. First, eliminate misconception and discrimination. Reduce prejudice and discrimination against people living with HIV and promote social inclusion through scientific and correct information. Number two, provide methods encouraging timely testing to reduce the spread of HIV. Number three, provide support and resources. Provide psychological counseling for patients and their families to reduce mental stress and reduce available medical and social resources. Number four, encourage technological innovation in the academic and medical communications. Number five, policy advocacy, promoting the implementation of effective intervention programs by the government. The last one, community participation. Encourage community participation in the prevention and treatment of AIDS and creating a supportive environment. Next, we will invite experts in the field of AIDS to help us understand the situation of AIDS in different parts of the country. For example, to reduce the spread of AIDS around the world. Number two, what are the introduce what are the high prevalence areas, people with high prevalence, and the causes of the spread of HIV. Third, information on HIV prevention policies. And last one, the list of progress in the world in related areas. So let's move on to part C and part B. Part C, question and answer sessions. Allow participants to ask questions and interact with experts to address their questions. Part D, educational materials, prevention and detection materials. Next, I will explain how to choose a speaker. We can invite professionals from the following areas as our speakers for this event. First, medical professionals, for example, doctors and epidemiologists. Number two, community leaders, representatives of local AIDS advocacy groups. We can also invite people living with HIV to share their experience. Regarding the choice of platforms for the meeting, we chose Zoom because Zoom will not be restricted by the inter-country internet, and people from all countries, including China, can participate in these events. Let's move on to the next people.
After the previous specific planning, we begin to officially enter the promotion activities. This part is divided into 1, promotion activities, 2, preparation of presentation materials, 3, preview. The main purpose is to conduct further research and implement the prevention programs on the basis of the awareness of AIDS prevention. First, let's look at the promotion activities of the seminar. In terms of social media promotion, we will use various popular social media platforms to maximize the exposure of the seminar. For example, Instagram, TikTok, and Facebook. We will be posting teasers and short video on Instagram and using Instagram story and IGTV to further promote. On TikTok, we create short funny video and use the AIDS hashtag to get more attention. Facebook creates an event page. Updates it regularly, preview it via Facebook Live, and invites speakers for interactive Q&A sessions. Next is the preparation of presentation materials. Presentations are carefully crafted to ensure that they are accurate, comprehensive, and engaging. The presentation will include key content such as the status quo of AIDS, prevention measure and control strategy, and use a constant visual style and rhyme elements to ensure professional visual effects. Finally, the rehearsal session. In order to ensure the smooth running of the workshop, we will conduct a comprehensive preview and test. The first is technical testing to ensure that the software and the platform used will function properly, including audio, video, and screen sharing capabilities. At the same time, ensure that the network connection is stable to all audio network problems affecting the workshop. We will organize speakers to contact the simulations, familiarize themselves with the process, adjust the content and pace of the space, and make emergency plans to cope with unexpected situations. So the above carefully planned promotional activities appropriate sufficient publicity materials and careful rehearsal. We believe that the AIDS promotion and control webinar will be successful in popularize the knowledge of AIDS to more people.
Hi everyone, I will introduce a summarized action item of this activity. I would like to verify the determining the seminar program plan event contain follow-up feedback questionnaires and calculate the cost of conducting a webinar. First, action and participation. Design interaction season, such as Q&A, voting, group discussion, act to increase the interactivity and participation for participants, and arrange dedicated person to monitor the chat window and Q&A season and responding to participants' questions and feedback in a timely manner. And then the recording and feedback. Record the whole process of the seminar and provide a replay link for those who cannot participate in a real time to watch. Collect feedback from participants and understand the effectiveness of the events and the suggestion for improvement through questionnaires or online evaluation forms. And we also should follow up the participants to understand their feelings and experience to guide our subsequent improvement directions and expansion. Summarize the reflect based on feedback to improve the plans and the execution to follow up activities. Some thank you emails to our participants provide the relevant resource and information and maintain ongoing communication. Next is about the future plans. First one, increase social media and digital promotion. For example, we can find a blogger on social media who are interested in our project to promote it, help grow our presence on social media. And the second one is explore new forms of communication. For example, we can interact with the participants through other forms of communication of computer networks, such as video commands or game Q&A. And the last one is volunteer and public engagement. And we can search the public by supporting volunteers, and we will gain great power. And the last part is calculate the webinar deliver cost budget. This is our cost budget for project, which include the platform and the technology fee, online advertising, email marketing, speaker fee, contact production fee, staff salary, management fee, print and postage cost, and supplement expenses. Estimate 14,000. That's all our speech. Thanks.